we are prejudiced, then the first mistake we make is that we don't observe properly. I can explain this by sharing a case. One of my patients, they used to come as a husband and wife when they used to come meet me. Of course, the patient was under treatment for Hashimoto's thyroiditis. Now, I have been giving treatment for this patient for past few months. There was a thyroid nodule, but yet my medicine was not helping the patient. So, it was really bothering me that something I am missing in the case, because of which I am not able to crack or cure the patient. Now, every time the husband and wife used to come, the wife was of course the patient, the husband and wife used to come, they used to argue, sitting right in front of me. There are times when I have been, oh God, why they are always fighting, and God knows how things are there at their home. But after a few such sittings, once I just paid attention to what are the things they keep on fighting about. So I told that you have to be careful, you have to take care of your health. When I was telling and advising the wife, the husband told, God, doctor, there is no point in advising my wife. I told, why are you telling that, sir? I told, you don't know. If I try to help her also, she can't take the help. If my kids also try to help her, she is not ready to take it. I told, can you please explain what you actually mean by that? And I told, see, what she does is that, now if there are some vessels, now this wife is working woman. Now if there are some vessels in the sink and I wash the vessels or clean the vessels, then after she comes back from the job, she cleans those vessels again. And if my daughter sweeps and sops the house, then she does the job again the second time. Now this seemed quite intriguing, and then when I asked the wife that why does she do that, then she told that I feel it is not clean. I have to clean the things again and again, at least 4 or 5 times to be satisfied that it is properly clean. Now this behavior of patient, of course, pointed to arsenic, which was covering all the other symptoms also. When ASAR was given, believe me, within 2 months the thyroid nodule just vanished. So sometimes when we are prejudiced and we just see things right in front of us, yet we see and we don't observe. So we don't observe properly if we are prejudiced. I was prejudiced by their fight. Then why are they fighting so much? But I never paid attention to what they were meaning to say. And because of that, I would have literally missed the case. But it was good grace that I was saved, right? The patient was saved in the nick of time. So we don't observe properly if we are prejudiced. Now the second mistake what we do? We do wrong observation. Very recently a patient came to me and he told about his complaints. Of course he's suffering from severe urticaria and he has tried all different methods of types of medicines. Now he had come searching for cure. And in this case, when we started treating the patient and we went in deeper for the life space investigations, we found out that this patient told that when he was a child, he was actually born and brought up in USA. Then he had to come and settle in India. Now they came back to their roots, and when the child was brought here, he could not cope up with the situation. The child became very shy and he told that he became very reserved. Now of course again we were prejudiced when he told that he is reserved, that means he is more sad and he is depressed. But then when further investigating, we found out that in that situation we normally expect people to be depressed, but the child turned out to be anxious. Now because of the anxiety, he started sweating a lot, and each time he used to sweat, he came up with bouts of urticaria. So sometimes if we are not paying proper attention and we are not observing correctly, we may make prejudiced decisions which might cost us our case. So wrong observation is a very big drawback of being prejudiced. What other drawbacks we have of being prejudiced? That is, we make wrong proper observation, then your totality or portrait of disease itself starts getting affected. What other drawback? If wrong portrait, then wrong selection of medicine. So then, if these are the drawbacks of being a prejudiced observer, then how can you be an unprejudiced observer? What are the things you have to do to be an unprejudiced observer? So to be an unprejudiced observer, first thing, we should keep our senses alert. That is, our eyes, our nose, our ears, everything has to be very alert when you are taking your case and prescribing the medicine. Then second, you have to be a very good observer. Seeing is not observing. You can see things, but when you observe it, you give importance to it and understand it better. So you should know what is happening with the patient around you. You would have seen that sometimes a patient comes and sits on the chair. Now his just gesture of coming and sitting on the chair will help you certain times to understand his behavior and even select a remedy. For example, a patient comes and sits at the tip of the chair, shows his anxiety. If he comes and keeps on shaking his legs, shows his restlessness. So a good observation is very essential to be a very good practitioner. Third, we have to maintain eye-to-eye contact while taking the case. Now, why do I give so much importance to it? You have to understand that when a patient comes, initially when we have started our practice and we are too anxious about the patient and we just start writing down whatever the patient is telling. When you do that, you usually miss certain emotions or certain physical features which the patient is trying to explain to you. And you will not be able to make a proper totality of symptoms. So, eye-to-eye contact maintaining, understanding what the patient is telling and then noting it down, taking time from it is very essential part of case taking. So, this helps in being an unprejudiced observer. Same way, so when do you start observing the patient? You start observing the patient the time the patient enters the clinic. Why is this important? Everybody just enters the clinic, just simply comes and sits. If that's what you think, then you are mistaken. Now there are certain patients who open the door and they say, "Good morning doctor, how are you today?" Then there are certain patients who come with a very sunken face and as soon as they sit, just without even maintaining an eye-to-eye contact, they start complaining about their symptoms. Then there are certain patients who are very anxious and their anxiety is seen by the way they tell their complaint. So the time the patient enters your clinic, that is the time since your observation should begin. So to be an unprejudiced observer, you have to avoid the drawbacks and understand how to be a good observer, which will help you in treating the patient. Thank you. That's all for today.